Crisis is brewing in 5 counties across the central region as nurses under the Universal Health Coverage, that's UHC program, stage protests over alleged violations of their employment agreements with the national government. Nurses from Embu, Meru, Tharaka Nithi, Kirinyaga and Murang'a counties who held joint demonstrations in Embu town demanding permanent and pensionable contracts along with payment of gratuity that has accrued over 5 years of service under contract terms. Our reporter Arnold Adidi has the latest.
Hundreds of nurses from Embu, Meru, Tharaka Nithi, Kirinyaga and Murang'a counties today shunned their workstations, jointly taking over the streets of Embu town in a bid to put pressure on the government to heed to their long-sounding cry. Led by the Kenya National Union of Nurses chairperson Joseph Ngwasi, the health workers have accused the Ministry of Health for violation of an agreement that they had in early 2020, which demanded that the nurses be employed on permanent and pensionable basis after the lapse of their 3-year contract.
Tumekubaliana na serikali kwamba baada ya miaka mitatu wataweza kupewa kandarasi ya kudumu ama permanent and pensionable. Lakini ilipofika mwaka wa 2023 badala ya serikali kuweza kubadilisha ile kandarasi kukuwa ya kudumu, waliweza kuongezea kandarasi ingine ambayo ni kinyume na sheria na ni kinyume cha makubaliano yale yalikuwa hapo mbeleni.
Apart from violation of the agreement, the nurses say that they have continually been underpaid by the government, a situation that hinders proper service delivery.
Hii mwaka contract inaenda kuendi tena na hakuna kitu ametuambia. Kwa hivyo tunaomba serikali tuangalie, tupewe kazi mzuri, tukae kama wengine, tuhudumie wagonjwa tukiwa tunafurahia. Na tukiwa tuko na hata sisi watoto wetu wao wako na afya, hawafukusi shule, atufungiwi nyumba.
For the last 5 years we have been on contracts. Since 2020, when we were employed during the COVID-19, we have been tortured severely psychologically.
The hundreds of nurses from Embu, Meru, Tharaka Nithi, Kirinyaga and Murang'a counties have vowed to stay on the streets until their grievances are effectively addressed.
Iko very clear kwa katiba, a work of equal value must attract equal remuneration. Yes. Na ndio sababu wauguzi wako hapa kwa sababu wamebaguliwa na serikali.
We are requesting them through our CS, Madam Dibora, may they hear our plea that we UHC nurses and even the other UHC staffs, we are requesting to be employed on permanent and pensionable terms, and also we be paid our gratuity, which we have been serving for the last 5 years.
On the other hand, clinical officers across the country through their union KUKO have today issued a 7-day strike notice set to commence on 18th of February. The clinical officers who are also serving under the UHC program have expressed their disappointment with the government's silence over their issues despite writing several petitions. KUKO is now demanding for permanent and pensionable employment terms for clinical officers, as well as harmonization of their salaries in line with other civil servants. KUKO also demands the full remittance of National Social Security Fund NSSF contributions for the period served. Arnold Adidi, TV 47.